A family reached out to me looking for guidance around supporting an older loved one who had just detoxed from alcohol use and was now in a medical rehab. The family had questions like, how can I best support my loved one in their recovery? How can I help my loved one get back to independent living, which is the loved one's wish? And how do we differentiate what is mental illness from substance use, from delirium or dementia or withdrawal symptoms? And so these are all excellent questions. And so here is what I suggested. They set up a care conference. And this is so everybody can get on the same page about what the older person's wishes are in their own recovery and how the medical rehab team and the family can best support them. Another is to understand the etiology behind the symptoms. And sometimes this early in recovery, it's hard to differentiate the etiology of the symptoms, meaning it's hard to understand what's underneath. Is it dementia? Is it delirium? Is it detox? Is it depression? And so it can take time to really uncover what's going on and what's under the surface, and the time for the person to stabilize. Especially older bodies need longer to stabilize. They take longer to recover from delirium and so on. And so part of that care conference can be to ask questions to the medical team and psychiatric team. What do they think is causing these certain symptoms? And how long do we expect these symptoms to last? Request clear milestones for independent living. So to work with physical therapy and occupational therapy, social work, the medical team, to really understand what do they need to see the older person demonstrate to recommend independent living, and also what supports can be activated in the community, like home health care and other independent living at home supports that could help the person return to independent living. Important that they request for a medication review, especially with older adults. There are a lot of contraindications for medications with older adults, and this takes pretty sophisticated pro and con conversations about the risks with medicines versus the benefits of medicines. And then with discharge planning is to be sure that they have all of their appointments set up that they need, like physical medical care, mental health care, psychiatric care, medications to help reduce cravings if that's appropriate for this person, clarity around the family role. And so different family members will have a different role with the person, and working together as a family to establish what is okay for family members to do and the identified patient's own boundaries are, what they actually want help with, and what the family wants to help with or sees the needs are. And this is where a mental health provider could be incredibly helpful in helping the family to navigate these new roles and to communicate effectively.